I'm Dr. Aldo Leopardi, and I'm a prosthodontist, a specialist dentist in the field of reconstructive and cosmetic dentistry. And I'm an educator and a clinician. Prosthodontist is a dentist who's had additional training at the university level, postgraduate level, usually 2 to 3 years full-time education to specialise. And the specialty involves reconstructive dentistry, replacing missing teeth, and cosmetic dentistry. Essentially, a prosthodontist is a dentist that helps adults that have specific treatment needs. I went to dental school when I was 17. I graduated when I was 21. So I was the youngest dentist in Australia when I graduated. And one of the benefits of being a young professional is I get an opportunity to experience my profession and determine what it is that I want to do and have time in my life to pursue other goals. I was a general dentist for 6 years before I realised I wanted to specialise and be a better dentist. And that's when I went to North Carolina, Chapel Hill to become a prosthodontist. And that was a 3-year program, full time. And when I graduated from that, I was 31 years old, so I was still relatively young. Then I went back to Australia. I was a prosthodontist there in Australia for several years, and I found my way back in North America to teach and go back into clinical practice as a prosthodontist here. So now I've had a dental license for 26 years and had the benefit of being in private practice most of that time and also academia for part of that time. Most patients are kind of fearful or apprehensive or anxious about getting work on their teeth, and that's quite understandable. The advantage of seeing a prosthodontist is that individual has a higher skill set, has higher confidence, and has the ability to execute the treatment in a timely manner, in a manner that's comfortable for the patient too. It's important that a patient finds a provider, a dental provider, that they're comfortable with, they're confident with. And when you're dealing with advanced cosmetics or personalised cosmetics, when you're dealing with function, when you're dealing with tooth replacement, that's where the prosthodontist can really help that patient. To be that dental provider that will get the treatment outcome that the patient wants, but also in a manner that's going to be the least apprehensive for that patient. When a patient sees me in their first appointment, the first appointment is really getting to know each other in a sense, and it's important that I get to know that patient. It's an appointment of discovery in terms of what it is the patient wants, and also diagnostically, gathering information. And on my own time, I put together a plan. It's a treatment plan, and it talks about the patient's list of findings and problems. It talks about all the treatment options that are available to the patient. What does this cost? What do these different options cost? And what are the payment options? I strongly encourage following this process of discovery and treatment planning and disseminating that information in teaching the patient. I always encourage my patients to seek other opinions because I want them to know what other ideas are out there, and I want them to be comfortable with the treatment direction that they choose. But more importantly, I want them to be comfortable with a dental provider that they choose. And whether it be myself or another dental provider, they will be able to work out for themselves what's a good fit. And once they discover and go through the experience in my office, that will help them determine whether my office is going to be a good fit for them. As a prosthodontist, some of the procedures that I offer my patients include crowns and bridge work, and that is repairing broken down teeth, rebuilding those broken down teeth. Restorative, complex restorative. Cosmetic dentistry also, such as porcelain veneer therapy and bonding. Whitening procedures, that's part of the whole process. But patients are missing teeth too, so my specialty involves replacing missing teeth, whether it be one tooth or multiple teeth or even all your teeth. When replacing one or multiple teeth, often that's done with dental implants. So dental implant therapy is part of my specialty as well. Another service that I provide for those patients that may not be implant candidates will be removable surfaces. They're dentures, whether it be partial or complete dentures. So essentially, it's a reconstructive specialty. It's a rebuilding specialty. It's a cosmetic specialty. It's a specialty that primarily helps adults and also helps younger people that have got congenital problems like missing teeth or been in various trauma-related incidences where they've broken teeth because of trauma. So I help young people with that also. One of the most rewarding things about what I do in my profession is I have an opportunity to affect people's lives and improve the quality of their lives by giving them function back, giving them some aesthetics back, in other words, giving them self-esteem back, so that they can live out their lives comfortably and with confidence and the esteem that they need to excel.